Wow. Hello, good afternoon. I'm your host, Dr. Festus Osai. I have a special important announcement to make. And I know it will impress you because in less than 48 hours, this whole thing will come to bear. We're talking about the Lagos Executive Ultrasound Scan Training Workshop coming up on the 24th, Tuesday 24th of January to 28th January 2023. It's a masterclass and it's a program that you need not to miss. What are the highlights? The highlights goes talking about we're going to start 10 a.m. in the morning daily. Venue is at the World Medical Center, 22 Itire Road by Randall Junction between the Duelegba and Lawansin axis, of course, in Surulere. Early beds have been concluded. Late beds will be concluded tomorrow in just about 24 hours from now. What are you waiting for? Register early and save yourself some money. Then if you know you cannot pay the full money and you want to register at the late beds, you can make a part payment. So when as the program starts, you can make your full payment. We're expecting you, no problem. Now you look at the payment portals displayed on the screen. Now, that's my book. If you need it, just give me a call. What are the highlights? This is a peculiar training workshop because there are some certain areas that have not been done before previously that have been inculcated into these training programs. I'm going to show you them as we go along the line. Now, this is talking about the umbilical artery Doppler and mid-cerebral artery Doppler. A lot of us have Doppler machines, color Doppler machines, spectral Doppler machines, but we've never used them for one day. May I tell you, there are a lot of things you can do with your Doppler machine. You come, we're going to teach you how you're going to do it. And it's very simple. Once we give you the secrets and the tricks on these, how these can be achieved. This is a mid-cerebral artery Doppler. How do you make this interpretation? We're going to tell you how you do that. Of course, this is umbilical artery Doppler. I'm going to tell you how you're going to get there. We're going to do it along the line. We're going to look at fetal anomaly scan, anencephaly, hydrocephalus, and microcephaly, and other ones going to show you along the line. Then one of the major highlights of this training workshop, we'll talk about transrectal ultrasound scan to look at the prostate. Let me tell you, prostatic ultrasound, is best assessment is via transrectal view as compared to transvaginal view, abdominal view. So we're going to show you the techniques on how this approach can be done so you don't traumatize the patient. There are different methods, but the trick I'm going to show to you. And of course, those of you that want to do a biopsy, if you know this procedure, it makes it easy for you to make a biopsy of the prostate. Especially when you are picking up when they have something. Sometimes you may have a prostate that looks essentially normal, but with the transrectal ultrasound scan, there's some certain features you see, you'll be shocked by the revelation they're going to see at the end. They want to show you as you come to Lagos. Then take note, transrectal ultrasound scan is not only for males, it can also be done for females. Try to compare this, the transvaginal scan, you can see through the vaginal area. Then the next one goes to the rectum, which is through the rectum to also look at the uterus. Talk about transrectal ultrasound scan. Some will say, why? Yes, you can do transrectal ultrasound scan. You want to look at the uterus, you want to look at the ovaries. Especially for example, you want to scan a female that is a virgin that's having a gynecological challenge, or you want to scan a woman with a cervical CA, suspended cervical CA with bleeding. So you don't want to go through the vagina and provoke bleeding, so you can go through the rectum and get your results well. Then we're going to look at follicle tracking sex selection ultrasound scan. How do you identify a viable egg? How do you know how well the follicle is growing? And how do you predict to know when intercourse can take place so you can have a male child or a female child? Someone says, is it possible? Yes, I've done this. I've been doing it for the past 10 years, and I can tell you the results have been fantastic. Although it's not 100%, but at least the results have been quite encouraging. Sometimes you are scanning and you're finding difficult to do a transvaginal scan to pick up the uterus or to get the ovaries, especially for patients that have had adhesions, maybe from previous surgeries or so thereabout. Well, we're going to teach you the maneuvers on how you can do the simple maneuvers, how this can be done to get the result right. Then we're going to look at thyroid ultrasound scan. We're going to have a look at the scrotal ultrasound scan. Yes, this is a very rare ultrasound scan that has been done in males. The commonest is abdominal scan in males. But scrotal ultrasound scan, I will tell you, if you conduct scrotal ultrasound scan, a lot of men, you'll be shocked with the features you're going to see at that point in time. If you're doing a case of infertility in a couple, do endeavor to do a testicular ultrasound scan, and you'll be shocked with what you discover. This you can also do at the confines of your office. We'll teach you the techniques as well. We're going to look at the breast ultrasound scan. We're going to look at solo HSD ultrasound scan assessment of the Sherman syndrome, endometrial polyp, of course, looking at tubal patency. So this one you can do in your facility. I'm going to teach you how you're going to do that. I'm going to show you the basics. It's very simple. Tell you the safety tips and the rest on how this can be done. Of course, We're going to look at other aspects. Those ones I just highlighted are the major ones, but these ones can go into them so that you can brush up and see other things. For people that are just coming for the first time, we're going to look at fetal gender assessment and identification, the techniques on how you can do that in ultrasound scan. We're going to look at fetal maternal rotation, ectopic pregnancy, uterine fibroids, placenta previa, of course, abruptio placenta. Others include knocker cord look assessment, fetal anomaly scan, assessment of intestinal obstruction, perfect PUD, splenic rupture, and a host of others, so that when you go home, you say you've had a wow experience. Some will say, is it possible to get through this within this time frame? Yes, I tell you, it is possible, and it's a promise. We'll get through it, and of course, you will not go home the same. Now we'll look at see you in Lagos, and I will say thanks for listening. Remain blessed. I'm your host, Dr. Festus Osai, waiting to see you in Lagos. Thank you very much.